Coming to you live from Southern Adventist University, I'm Spencer James Kingsley, and we have some breaking news. I'm sorry to report that 4 were found dead on the promenade this morning. Well, and that's what I'd be saying if it weren't for our great nurses jumping into action without a second thought, reviving each and every one of the 4. So, in honor of this great heroism, we here at the studio would like to take a moment and talk about nurses in America. Nursing dates all the way back to 1873, with the first official nurse being that of Linda Richards. She was the first person to ever establish nursing programs and practices that nurses to this day use. She is the most known for being the first person to start recording patients' medical history through the use of medical records. The practice is not only used in the US, but also the United Kingdom and Japan, making her one of the most influential people of her time. Changing pace here a little, let me ask you a question. When you go see a doctor, who is the first person you see? Who leads you to the waiting room? Who checks your vitals, height, and weight? The answer is most likely going to be a nurse. See, the fact of the matter is, as we breathe, there are over 3.1 million registered nurses in the United States alone. And while you might be thinking to yourself, the number of doctors surely outweighs the number of nurses, you'd actually be wrong. There are only a little over 1 million doctors in the US. The number of working nurses clearly dwarfs the number of doctors. We could talk numbers all day, folks, but particularly the practicality of nurses goes way beyond just taking someone's weight. Like they say, variety is the spice of life, and I guess the same is true for nurses as well. Nurses have a wide variety of specialty that they can go into, such as pediatric nursing, oncology nursing, CRNA nursing, or even nurse practitioner, which are nurses that, like doctors, can prescribe medication. While these are just a few of the literal hundreds of job types a nurse can go into, the most common being that of the standard registered nurse. These are the kinds of nurses you'd most likely interact with the most. Before we go any deeper into our topic today, I want to touch upon some pretty big misconceptions about nursing that I found. When you turn on a hospital drama after a long day at work, who is depicted as the doctors and who are depicted as the nurses? Men are usually the doctors, while the women are portrayed as nurses. This can be found in many forms of entertainment world, and because of this, the term nurse has a connotative presence that forms this idea that women are always going to be the nurse. This simply isn't the case, ladies and gentlemen. There are over 300,000 men working in some nursing field across America. So, while the media likes to paint this picture that men don't want to be or can't be a nurse is ridiculous. This is work. There is work to be done in the hospitals, no matter what gender. Speaking of work, the workload for a nurse is something not to be underestimated. While the average work week for a nurse is only about 3 days, they can work up to 13 hours in a shift, some nurses even pulling a double shift. And let's be honest with ourselves, who would really be willing to pull off a 26-hour shift? Not I, folks. Not I. While nurses eat, breathe, and sleep nursing, they are still human, putting every ounce of effort into what they do. And ladies and gentlemen, with the time I have in this segment, I want to do a little bit of a deep dive into one of the forms of nursing. Nurses working on the floor level, meaning that they're the type of nurse that has a regular set of patients. They will have up to 6 patients that they see every day getting to know them for more than what they're there for. These people make real human connections, greater than that of any doctor, knowing specifically what to do for that individual when life hits the fan and things start to go south. So, from everyone here at the studio, we'd like to give a big Southern Adventist University thank you for all that you do and all that you will do. Good night, everyone.